Social media is an integrated part of society today. How might it affect the medical field? Today, I'll be discussing how medical professionals use social media in the medical field, the pros and cons of social media, and ways social media can be used wisely. For some healthcare professionals, social media is just another part of the job and can be a great asset. It can be a vital resource or a support system for like minded individuals. Social media can be used for professional networking, professional education, organizational promotion, patient care, and public health programs. Medical professionals can use social media as a way of networking globally. Doctors, nurses, specialists, and more can share information and connect on a global scale through social media, sharing information and advocating for public health issues. It can also be used educationally. There is a lot to remember when working in the medical field, and you can't know everything. Social media can be a great resource when trying to solve a problem or when you just don't know something. According to social media and healthcare professionals' benefits, risks, and practices, many studies have described the use of social media tools to enhance clinical students' understanding of communication, professionalism, and ethics. This goes to show that social media can be a viable resource when teaching students before they go into the medical field. Another way of social media can be used in the medical field is organizational promotion. Medical facilities, hospital clinics, and more can promote their organization on social media. This can inform people of their healthcare options when they have a medical problem and other doctors and clinics around their area. According to social media healthcare benefits and opportunities, recruitment in healthcare is taking advantage of social media to appeal to prospective employees and assess applicants for residencies, meaning that some medical companies use social media to expand the medical field employee base. Social media may also be used in patient care. There are platforms and other forums of social media where patients can ask questions for healthcare providers. Another use of social media in the medical field is public health programs. These create a relationship between the public and the healthcare system, allowing people to better be knowledgeable about mental and physical health and get care if they need it. These are some of the many advantages and purposes of social media in the medical field. Although there are a lot of purposes in the medical field, there are some advantages. Social media isn't always reliable. There's always chances of misinformation, self-diagnosis, security risk, and uncontrollable factors. According to Sanchez 2022, about 34% of top health stories for 2018 had misleading or inaccurate information. This can make distinguishing between the fact of what is made up between fact and what is made up difficult. However, if reliable sources are used, then this wouldn't be a problem in the medical field. Self-diagnosis is also a disadvantage. People can think they have a certain disease or disorder because they've seen the symptoms from an influencer or just an article they've read and hadn't checked the reliability of it. This can be a problem for healthcare workers. It is best to discuss symptoms of the person with a doctor and allow the doctor to diagnose the person. Another downside to social media is security risks. Patient information can be leaked from the forum or whatever they're using, and privacy can be invaded. However, there are protocols that can be put in place to decrease the odds of this happening. Lastly is the drawback of uncontrollable factors. What people say online is uncontrollable. Stigmatized comments, misinformation, and more can all be spread through social media and negatively impact patients and healthcare workers. However, these same things can be said in person, so therefore the problem isn't really social media, it's the people saying these things. When social media is used properly, there's less potential for risks and disadvantages. According to social media and healthcare tactics, tips, and tools, social media, when not used responsibly, can carries the risk of professional and legal repercussions. This means when used responsibly, the risk decreases. Ways to prevent risk are making social media policy, keeping professional when involving social media, protecting patient privacy, and being transparent and honest. Having a social media policy will help with the legal aspects of having social media in the workplace. Staying professional can help the public better understand the message and prevent information from getting distorted. Protecting patient privacy is always important, but when involving social media, it is especially essential. Make sure to only use secure platforms and to not share specific patient information without patient consent. Being transparent and honest is also really important when handling social media as a professional setting. Sharing evidence based information can help limit the spread of misinformation. These are all important things to remember when social media is in the medical field. Conclusion. Social media is an integrated part of society today, and learning to navigate it is important. There are many uses to social media in the medical field, and although there are disadvantages, if social media is used properly, those can be minimized. According to social media and its impact on healthcare, social media has already changed healthcare and will continue to do so in unimaginable ways.